Good afternoon, everybody. Today I'm going to talk about how our NHS is being abolished, how it's been broken up, privatised and corporatised. But I'm going to go back to the beginning because the NHS was created in 1948. And from the very beginning, it faced two major controversies. The first, that it was unaffordable, it was too expensive to have, and people would abuse it. In the event, the politicians were proved wrong. It was neither unaffordable, nor did people abuse it. The NHS was one of the 5 pillars of the welfare state that was designed and created by William Beveridge during the Second World War. And he designed it. This is William Beveridge here. You should see him a minute. And he designed it to slay the 5 evil giants of disease, ignorance, idleness, want, and squalor. And when the politicians said to him, "We can't afford the welfare state or the NHS," he was completely scathing in his reply. He said to them, "The abolition of want before the war was easily within the economic resources of the community. Want was a needless scandal due to not taking the trouble to prevent it." So in other words, it had nothing to do with affordability or income. It was a political decision. And it was all about how wealth and income was distributed. And the key, in his word, to the welfare state was redistribution. And that was what was designed, especially into the NHS. It became the fundamental principle. Now, Aneurin Bevan was actually the architect of the NHS that we know, and he went further still. He said society becomes more wholesome, more serene, more spiritually healthier if it knows that the citizens know that at the back of their minds they have the knowledge that not only themselves but all their fellows have access to the best medical skills that can be provided for them. But Aneurin Bevan also, and the architects, faced a second controversy, which was the role of commercialisation in the private sector. And the architects were keen to keep private interests out in order to prevent inefficiencies and squander and waste. However, there were few private interests after the Second World War when the NHS was concerned, except for the doctors, who, to a majority, the BMA, actually voted against the NHS, but they were later bought off. Or Bevan saw them off, rather. And actually what's interesting today is that the second and third and fourth generation of doctors remain the staunchest allies of the NHS. And here they are, a group of them, outside the ministry, fighting to save our NHS during the passage of the destructive bill, the Health and Social Care Act, that went through Parliament in 2012. This is the Act that brought in the 48 NHS, the 1946 Act. Beautifully simple, short, succinct and concise, nationalised everything. And this is the Abolishing Act, 457 pages of it, of legal, technical detail. And this is what the Act does. Fundamentally, the Act removes the 60-year duty on the Secretary of State to secure and provide healthcare for all citizens throughout England. As Owen described it, it is the Abdication Act. They've abdicated themselves of responsibility for our NHS. It only took 2 pages to remove the duty. The other 456 pages, 55 pages, are dedicated to a new market bureaucracy, bringing in insurance structures modelled along the US lines, and gives the Secretary of State powers to create a market. And, above all, it gives powers to new providers and insurers to pick and choose which patients will get treated, who will get care, and what services will be provided for. Now, every system has a bureaucracy. And the organising principles of the 1948 to 1990 NHS were very simple. Redistribution, you raise money according to income and you distribute it on the basis of need. It should be universal, there for everybody, free at the point of delivery. And above all, it was nationalised, brought under public ownership and control with public accountability and strong integration. Our NHS became the model maker for the rest of the world for more than 60 years. But the organising principles of a market bureaucracy, which this document is devoted to, are completely different. Anybody who takes out insurance knows that insurers are risk averse. And risk selection is the basis of a market. You have to be able to identify risks, predict them, price them, allocate them through a commercial contract, and transfer them through that contract. And of course, this all results in segmentation and fragmentation, quite different from an integrated healthcare system. So, if you remember nothing else today, I want you to remember that markets always operate through risk selection. And the structures and functions and bureaucracy of a market have to be designed to enable the purchasers and the providers to pick and choose the profitable patients and treatments and dump those that can't afford to pay. Now, every student of science or engineering or architecture will tell you that structures follow function. Structures absolutely matter, and yet our politicians tell us that they don't. And the reason why they matter is they have to follow the duties, the functions. So if you have a duty to provide universal healthcare to all the structures and funding have to follow that duty, especially if it's to be equitable. So in the NHS, the unit of public administration was always a geographic area. The Secretary of State devolved that duty down through areas. In a market, the unit of administration in terms of healthcare is the insurance fund. But of course, you know, in insurance, not everybody is covered because they can't all afford to pay. So this is the classic structure that actually became the model of public administration for many other systems throughout the world. And here you can see quite clearly that the Secretary of State is in charge. As Bevan said, he could hear a bedpan drop in a hospital, and he could hear it in Westminster. The Department of Health, and here you have the planning tiers of regions and districts, and everything was integrated very tightly so that there were no inefficiencies and no waste, no billing, no invoicing. Very easy to see who's in charge. This is David Cameron's new bureaucracy. This is what this is dedicated to, the new bureaucracy of the market. The Secretary of State has all the power but no responsibility. And now we have a series of regulators, economic regulator, a quality regulator, monitor, and the Care Quality Commission, and a plethora of new bodies. But the most interesting group are these clinical commissioning groups here in the blue. They are receiving £80 billion worth of funds every year, and they're modelled along insurance fund lines. So this is a new bureaucracy, and this is why nobody can understand who's in charge or what's happening today. And if we look geographically or structurally at this new bureaucracy, what you can see is that in the old bureaucracy of the NHS, the Secretary of State had his duty to secure and provide healthcare for all. He delegated it down through the red, which are the regional tiers, and then to lower tiers, which were either district health authorities or primary care trusts. But the important thing was that everybody was covered. All these areas were what known as contiguous, joined up. Nobody could fall through the cracks. Nobody could be left out. Nobody could be excluded. But in the new system, all the structures have been dissolved away. And instead we have insurance funds, these clinical commissioning groups here. Now, the first thing you can see is the clinical commissioning groups are not area-based. And the second thing is they take members from all over the country. But not everybody can become a member. Because to become a member, You don't join a CCG, you have to join your general practice first. But not all general practices in time will be able to join a CCG, and not all people can join general practices. So, what we can see is the groups that get excluded will be the homeless, migrants, asylum seekers. Many of them don't have general practitioners. They'll no longer be automatically entitled or covered. But older people may find it increasingly difficult if they're high risk or have multiple needs. And they'll be excluded in two ways, either by entrepreneurial GPs, such as those run by Virgin, or they'll be excluded because they've got chronic diseases, and the CCGs will no longer commission care for them, so they'll have to pay or do without. And this is a new system that's being designed. And this is what will happen. People will find that they've fallen through the cracks, unable to get care, unable to be members of a general practice, unable in turn to become part of a CCG, which is functioning like an insurance fund. And all these CCGs now have new resource allocation methods and funding mechanisms, which will make it increasingly difficult for people to get into them. So clinical commissioning groups are insurance-based. They're not area-based. Not everybody in an area is automatically covered anymore. People are recruited on the basis of belonging to a general practice, but people can become excluded or ineligible either because of their conditions of treatment or because of their own status. And the same has happened. This volume here has given huge new powers to these NHS providers. Services now are being broken up across the country. They're being put out to tender to commercial companies. There's not a day goes by when you hear of huge contracts. NHS hospitals are being starved of funds. They've been going into financial deficit. The administrators are coming in. They're either being sold off, franchised, or closed down. Complete loss of planning on the basis of need because nobody in your area has responsibility anymore. And now these new commercial providers who are coming in have new legal powers to decide who gets care, what they can get, and what they can pay for. The NHS has been reduced to a logo, a funding stream, £112 billion. And instead, we have a myriad of new companies. Here they are. PricewaterhouseCoopers and McKinsey's, which are running the show in the clinical commissioning groups in NHS England and the Department of Health. Virgin, which is bidding for £1 billion, 1% of the NHS budget, never provided care ever, and is taking some of the most vulnerable services for people with mental health and learning difficulties. Care UK, Circle, which is franchising for hospitals, Netcare, many of them American, South African, Canadian companies from all around the world. So £112 billion of NHS funds are flowing to hundreds of commercial providers, shareholders and banks every day of the week, £112 billion. So why is the government doing this? Well, it said it was all about patient choice, dignity, respect. But of course it's not about patient choice. It's about giving providers choice of patients. The other thing is the government said markets are much more efficient. But of course they're not. There's not a country in the world that delivers universal healthcare through a market. Not one country. And if anything, all the evidence shows that when you bring in a market, it becomes much more expensive. Look what happened. From 1948 onwards, healthcare costs remained around 3 or 4% of gross domestic product. The big increases happened at the period of privatisation in the 1990s and 2000, when New Labour came in with its NHS plan. That's what's happening. It's taking off. So from always being between 4 to 6% of GDP, it's risen dramatically. But the second thing that we should remember is the American healthcare system. America is what it's modelled on. 18% of GDP, the outlier at the very end. Twice what Britain's GDP is. And yet, in America, 61 million people, 1 in 5 people go without health care. They have no health insurance or coverage. 2/3 of all medical bankruptcies are due to healthcare bills. And millions of people spend 10% on healthcare costs. And it brings enormous new inefficiencies, a market that's not there in a publicly owned system. The first is insurers, marketing, billing, pricing, profit, insurer billing, physician billing, and hospital billing. Take a bigger and bigger, and then the administration costs, so that only 60%, 60 to 64% is left for medical care, to employ the staff, to buy the drugs, to buy the medicines. In the NHS, it was the most efficient system in the world. It was only 6% of the total budget went on administration costs, compared with what happens in the US, where it's between 30 to 40%. But markets also bring new pressures, because one of the things is that the job of a commercial provider is to find a treatment that you don't necessarily need, but that somebody will pay for. And the Institute of Medicine in the US has come out at nearly $3 trillion spending in the US, where more than $1 billion, $1.5 billion is completely wasted. Sorry, $1 trillion is completely wasted. The noughts are too many to comprehend. Unnecessary services. The companies that now in the UK, like Hospital Corporation of America, are being done for fraud and embezzlement and treating patients for heart surgery that they didn't actually need. Inefficiently delivered services, excess administration costs, prices that are too high, misprevention opportunities. From the most distinguished Institute of Medicine report, over $1 trillion. Extraordinary. That's what lies ahead for us, because it's the American companies and the American health insurers that have been putting pressure to remodel the NHS along US lines. So if what I've said today has shocked you or surprised you, then it's our NHS, and you have to do something. And the first thing is to support David Owen's bill. I'll put pressure on all the parties to support this bill. There's a bill currently in Parliament in the House of Lords which will restore the duty on the Secretary of State to secure and provide healthcare for all. And at one fell swoop, that would dissolve all the structures. You must campaign against all the privatisation and commercialisation. The £1 billion pound contract that's currently out with Virgin tendering for it. Campaign against all the hospital closures and mergers, because they're code for the great disposal and sell-off of our NHS. Join campaign groups, lobby your MPs, like Keep Our NHS Public. Think very carefully about what you're going to do next. Bevan said, our NHS will be there for as long as there are folks left to fight for it. So I put it to you, it's our fight now. Thank you.